Alright, so how's it going? My name is Mishi Kobe. I'm a freshman here in college, and
I'm Corlin Perkins, and I'm a junior in college.
so basically what we're going to talk to you today, following the theme, I guess, of today, is exercise and mental health. And really what we want to emphasize today is, as you can see by this little emblem, mens sana in corpore sano. This is the Latin for a healthy mind and a healthy body. So we really want to emphasize today the strong connection between a healthy mind and a healthy body. So we just want to start out off the bat with a quick little survey, I guess. So if you guys just could yell out, I guess, how often you guys exercise, and then I want you to think throughout the presentation about this second question. What changes do you feel right after you exercise, a few hours after you exercise, or the next day? So just keep that in mind in the back of your head, and then we'll address it at the end of the presentation. So hopefully, we'll go back to it at the end.
So this idea of like exercising helping your mental health, it can seem like magic, like some aspect of like you don't really know how it helps, but it's just some way you just feel better. And in some of those ways, it's just that it's been proven that it does reduce anxiety and depression. And it also reduces negative mood. So exercise like has a positive effect on just how you feel, right? Even the immediate effects after a good run or a good ab workout or something of that nature. It also increases self-esteem and how you feel about yourself, and also increases cognitive function. So also the way that your brain processes, it influences blood flow to the brain, and also can even help with memory.
So in the first study we're going to talk about, this was done by Dr. Lindholm, and basically what this researcher did was he basically wanted to determine what the effects of exercise are on quality of life. And quality of life was measured by self-reports from the subjects of the research. And basically they measured the way you exercise by metabolic efficiency, which is done by taking your maximal power and dividing it by respiratory gas exchange. So that was done scientifically. And then following the experiment, they showed a huge correlation between exercise, again measured by metabolic efficiency, and the self-reported quality of life. And this correlation obviously shows that there is a huge impact that exercise has on your mental health. And so these are
some of the biological effects of exercises. You've probably heard before that there's an endorphin release, or some is known as the runner's high, immediately after running. There's also produces anesthesia or feelings of well-being. So this idea of, like I mentioned before, like this self-esteem, immune increase, and increasing your or decreasing negative moods. And also the dopamine release. So just this is kind of a picture kind of depicting how your neurotransmitters respond to these releases of these chemicals within your body. It like makes you happy, so to speak, or it increases positive effects biologically. So exercising on your mental health, some of the studies have shown that evidence shows that exercise may be a neglected intervention in mental health care. So exercise being used as a medicine as far as those mental health patients who are already been diagnosed with a particular mental disease or mental condition. Exercise has been proven to be an intervention in that as far as being like a medicine to those patients. Some studies also found that this boosts activities in the brain, frontal lobes, and the hippocampus. Exercise also has been found to increase the levels of brain-derived neurotrophic factors, and basically that just means it increases your mood, as we've already stated before. This is more the scientific background for the improving of your mood. This is what you get benefited from by exercise. So in the second study done by Dr. Blumenthal, this is just a study in 1999 that showed they took a group of patients who had been diagnosed with depression and used exercise as a way to be an antidepressant for these patients. And this study showed that there was a major increase in these patients' well-being because of this implementing exercise in their daily activities.
So some examples of exercise that could work, here on campus. Running, for example, I know for myself, it takes me about anywhere between 12 to 15 minutes to walk to Emery Point, And so many doctors recommend that you do at least 30 minutes of moderate intensity exercise per day. So for example, walking to Emory Point right down Clifton Road is a great way for Emory students. I know for all freshmen, again, it's about a 12 to 15 minute walk at a brisk pace, and that's basically perfect, exactly what you're going to do. And then another is 8-minute abs. A lot of people today have a smartphone. There are a lot of, Cortland has the app up if you want to come up and take a look. Another great way, it's a free app on the Android store, Apple store, what have you, and that's another great way. And also exercise, as we said, has been proven to increase mood, and then Cortland's going to demonstrate a few quick exercises.
Right, so with 8-minute abs and exercises such as with this resistance band, if you even don't want to leave your room, these are exercises that you can do within your room, within your apartment, that aren't so, don't have you even have to get out of your, near your bed, away from your bed. So this is an exercise that I personally do, just using the resistance band, just standing on it, creating some resistance, and just arm curls or anything that will demonstrate, that will, get your blood flowing in regards to it and not even have to leave your room to do it. Like we mentioned, the 8-minute abs, which is great. I'm going to start the program. They have it all set up for you to where like you just progressively increase in regards to your level of activity and just your ab workouts. And like we said, these are all things that could have a positive effect on your mental health.
And so some quick takeaway messages that we really want to drive home today. Again, like I just said, moderate intensity exercise for about 30 minutes a day. That's perfect. Again, this is running through low water even. Ab workouts at home, and also, like we said, a quality of life improvement. This is also self-perceived, which is huge in mental health.
And with that, some of the biological effects, as we mentioned, the neurotransmitters, so the dopamine and the endorphins being released, or the runner's high, immediately after workouts, and how exercise can elevate your moods and increase just the way you feel about the way life and about yourself. Decreases anxiety, increases self-esteem and cognitive function, and like we mentioned, brain-derived endocrine factors, which are the scientific way of just saying that these things, the increase of those will have a positive effect on your mood, and just having a better mental health because you have a better physical fitness.